Maria's story is probably the most impactful. I've had it called a suck the air out of the room horror story in the past, but it's one that I think we need to think about. So Maria's story. A general medical team was serving a village community in Central America. Maria, 29-year-old mother of 5, arrived at the clinic pharmacy to receive her medications after having her entire family seen by one of the physicians. Maria had 3 prescriptions for herself, and each child received prescriptions for parasite medication and vitamins. In addition, 3 of the children were febrile, and 2 had been diagnosed with otitis media, and 1 with strep pharyngitis. Each of them also received prescriptions for antipyretics, Tylenol, and antibiotics. Maria waited patiently with the handful of prescriptions in the pharmacy waiting area. The pharmacy line was long, with about 75 people waiting to fill prescriptions. There were also people waiting to be seen by the dental, medical, and health education volunteers in that area. Maria finally got to the pharmacy counter, and her prescriptions were filled by a pre-med student under the supervision of a nurse and a paramedic. The paramedic provided instructions for each of her children in all of the medicines. Doses were explained to Maria, and instructions were written in her own language for 12-year-old, 6-year-old, 6-month-old children. However, Maria could not read. She then took them home to her one-room dirt floor shack of a home where there's no place to store them, store those medications safely from her children. Less than a week later, after the team left, Maria presented to the public hospital in the region with her youngest child in acute liver failure, having been overdosed by Tylenol for over a week. This was a real case study that I collected in Santa Rosa, Copan, Honduras. And it was then that this case study rocked my world. I got to tell you that this was the one that said, we need to really think about this and what we're doing in short-term missions, in short-term medical missions, and how do we do it better? So it's not a criticism to point some of these case studies out. It's to say, okay, guys, as a community, how do we think about how to do this better? And what are the patient safety ramifications in this context? You know, when we look back to the hospital in Haiti, we see that our good intentions could have likely closed the only surgical hospital in the area. At the same time, if we knew the standards as a community of what are the standards that are supposed to be followed by short-term health teams after a disaster. There are some international standards based on that. They're called the SPHERE standards. And the SPHERE standards tell us that that's really about disease monitoring, disease prevalence monitoring, disease prevention. It's really more on the prevention end. If all of the volunteer medical teams that had been going into Haiti at that time would have understood what the standards are and what their role was in the disease prevention monitoring area, we may have prevented thousands of deaths with cholera. And at the same time, we wouldn't have affected the healthcare system in an adverse manner.